What if the medications meant to help? Your pet could also be the reason they got worse? Today, I'm taking a closer look at Zoetis, one of the largest veterinary drug manufacturers, and the growing concerns surrounding pet medications that have been linked to adverse reactions. Zoetis manufactures many of the most commonly prescribed medications in veterinary medicine for allergies, arthritis, parasites, heartworm, pain, infections, and more. Many of these drugs help millions of pets, but no drug is risk-free. Today's goal is not fear, it's awareness. I'm going to examine Zoetis drugs that have been associated with reported adverse reactions, and more importantly, what those patterns may mean for pet safety. This content is informational only and not medical advice. Always consult your veterinarian. Allergy and immune modulating drugs. Cytopoint, a monoclonal antibody injection for allergic itch in dogs. Reported adverse reactions include vomiting and diarrhea, lethargy, skin and ear infections, hypersensitivity or allergic type reactions in some dogs. Because Cytopoint alters immune signaling, reactions can vary significantly between individual dogs. Apoquel, an oral immune-modulating drug for allergies and itching. Reported adverse reactions include gastrointestinal upset, increased skin and ear infections, lethargy, Demodex flare-ups, immune suppression concerns with long-term use. Apoquel works quickly, but it also suppresses immune pathways, which can increase infection risk in some pets. Arthritis and pain biologics, BanNGFDrugs. Librela, dogs, a monthly injection for osteoarthritis pain. Reported adverse reactions include death, lethargy, vomiting or diarrhea, urinary tract infections, neurologic signs such as ataxia, weakness, seizures, or paralysis. Zoetis has updated Librela's label to reflect reports of neurological events. Solensia, cats, a monthly arthritis pain injection for cats. Reported adverse reactions include vomiting, diarrhea, injection site pain, skin reactions, behavioral changes reported by some owners. Thousands of adverse events have been reported post-approval, though causation is not always established. Lenivia, dog's newer drug, a longer-acting osteoarthritis injection. Key concern, because this is a newer medication, long-term and real-world safety data are still emerging. Portela, cats, newer drug, a longer-lasting arthritis injection for cats. Reported trial reactions include injection site pain, hair loss, dermatitis, swelling and itch. As with Lenivia, post-market safety data is still developing. Critical pattern, what these side effects have in common. When you step back and look at the side effects across all of these Zoetis medications, Cytopoint, Apoquel, Librela, Solensia, Lenivia, and Portela, a clear pattern begins to emerge. Despite treating very different conditions, many of these drugs share remarkably similar adverse reactions. Gastrointestinal upset, lethargy, immune or allergic reactions, neurologic signs, and injection site or skin issues. This overlap does not automatically mean these drugs are unsafe or harmful to all pets. Millions tolerate them without serious problems, but the closeness of these side effects does raise legitimate safety concerns that deserve scrutiny, transparency, and informed consent, especially when these medications are long-acting, injectable, or non-reversible. The stakes are higher if a pet has a bad reaction. Parasite and heartworm preventatives, Simparica and Simparica Trio, flea, tick, and parasite preventatives. Reported adverse reactions include vomiting and diarrhea, tremors, ataxia, seizures, even in dogs with no prior seizure history. The FDA has issued class-wide warnings for isoxazoline drugs, Revolution and Revolution Plus, topical parasite preventatives. Reported adverse reactions include application site irritation, gastrointestinal upset, neurologic signs, particularly in formulations containing serolaner, ProHeart 6 and ProHeart 12. Long-acting injectable heartworm preventatives. Reported adverse reactions include vomiting and diarrhea, lethargy, hypersensitivity and anaphylaxis, neurologic signs, immune-mediated reactions, rare deaths reported post-approval. Once injected, these drugs cannot be removed from the body. Pain, infection, and supportive medications, Rimadyl, Carprofen, NSAID pain medication. Reported adverse reactions include gastrointestinal bleeding, liver enzyme elevation, kidney issues, appetite loss, lethargy, convenia, long-acting injectable antibiotic. Reported adverse reactions include vomiting, diarrhea, lethargy, allergic reactions, serenia, anti-nausea medication. Reported adverse reactions include lethargy, injection site pain, gastrointestinal upset. Caution advised in pets with liver disease. Big picture takeaways. No medication is 100% risk-free. Long-acting and injectable drugs increase risk impact if reactions occur. Many adverse reactions are discovered after approval. Similar side effects across many drugs justify closer scrutiny. Transparency and informed consent are essential, especially for irreversible treatments. If your veterinarian recommends one of these medications, ask, why this drug? What side effects should I watch for? How long does it stay in my pet's body? What alternatives exist? If your pet experiences a reaction, report it to your vet, the manufacturer, and regulators. This data saves lives.